Hello everybody, Ismail Nouri with you, Bestcare Clinic in Dubai. This time we will talk a little bit in 5 minutes regarding above knee prosthetic and what is important for you to know if you are ordering an above knee prosthetic, and you have to be aware of some details. You cannot be exactly aware of everything which CPO will do for you, but we're gonna just help you a little bit to know what you are going to receive it. We will start with one of the prosthetic, which is the prosthetic. Here you can see that the joint is 3R92 from Orthotic, and this is like monocentric, which you can see it is like in one direction is rotating. It's very important to know and how the functioning, like for standing, for the flexion, extension, to come the position that when it is safe for you to stand. This is very important for you to know it. And regarding the food, we have discussed already earlier, according how you will decide which food you wanted. Honestly speaking, here I am not talking about your budget, your money, how much you want to spend. This is what exactly you need for the prosthetic. What was your case? What was your diagnosis? How did you get this amputation? And what is your age and the grade of mobility? This is all important to make you as an active person, indoor active, outdoor active, and really athletic sport active person. This is very important to know it. Then you can decide about food. And the socket here, it is always coming like with carbon made lamination for outside, but inside is either with shuttle lock and silicone liner. It is silicone liner with membrane. This is actually silicone rings, which is with the suction functioning without shuttle lock, or this is just a valve here and it is no shuttle lock, no silicone liner. It function only with vacuum, but in this case has to be fitting very good, otherwise will not function. And inside has to be soft socket liner, inner socket, and outside will be the hard one. Remember, this is one center rotation. Okay, we will just move on for the another one. In this one I will show you one called also monocentric. It's very simple joint actually. This is with called break joint. This is also very important, but this is not for very active person. It is for the people have like low grade of activity or old, little older person. Now here you can see this joint is actually from Osor. It's not from Orthotic, but it is polycentric. This is coming here. You can just see I am trying to bend it. It will not work, but if you are just pressing your finger here, very easy. See, it doesn't need any power. This is important to know what exactly you are ordering it and how you need to walk. You need also be trained to know how to stand, how to walk with this, and how to really get the use exactly 100% benefit of the prosthetic, which is could be 50,000 or above. This is very important for you. In above knee prosthetic, I remember the time when I was in Germany, always we have given here torsion adapter, which is making much easier and comfortable for the patient to have like in prosthetic under the pressure. Nicely, it still has a little bit of 10 to 15 degree rotation from the foot. This is also very important. And after this, all points are done. Selection of the joint, selection of the socket, selection of the knee. Then you can say that you have done all great, and you will be happy customer, and you will be really happy person walking, doing daily activity with your prosthetic. And the prosthetic finally, when it is done in the workshop, it will be for the trial will look like this. But when you are done with all adjustment, everything is done, the time when you are receiving the prosthetic to get with you home, In this time, the prosthetic has to look almost like this. It means cosmetic foam has to be nicely taken care for it. It has to be left and right of your legs when you are not bilateral amputee, has to look really similar. When you are sitting, when you are walking somewhere, doesn't have someone to do and to know that you are prosthetic patient and you are wearing a prosthetic. This is the art of making prosthetic. It's not just something to give you to stand. You must be really happy to walk, to do all your activity with it. And cosmetic is inside, and this is also the socks which is covering, also coming for orthopedic purposes. It's not the normal sock. This is really a bit more stronger material. This is also important to know about it. And always, please, this is my advice to you as a patient. When you are receiving a quotation, when you are confirming a work with any clinic in UAE, I'm talking now, but it could be everywhere around the world. Whatever is inside, the last day when you are receiving the prosthetic, you can't see it. If you are paying for expensive food, advanced food, when you are paying for very high quality knee joint, please ask for it. Even it is cosmetically finalized, ask your CPU. If you trust it, it's fine. If you are new, if you don't trust, or you wish however to know it, ask them to remove for you the socks, ask them to remove the foam for you and to show it to you. It will take maybe 15 minutes. The 15 minutes, it will give you the comfort feeling that you have received the perfect one, what you were looking for it. Not this doubt and the thinking that maybe something else inside and we have paid for something else. And here, this is actually, it was very short video. I think this was important for you to know about it. We will try our best to continue with our videos. We will go in details for, we have started with prosthetic first. We have started now in detail with above knee. We will go back to the below knee. We can go for orthotic. We can go for mobility, scoliosis. Please be in contact with us. Share your information with us. Let us know what exactly you wish, what you want to know. And when you are happy with us, please, down right side on the video, you can subscribe to our channel. Share this information, share this video with everyone, anyone you think that maybe needed to know this information, and stay with us. Please, see you in next videos. Thank you very much.